Medical disclaimer. The information in this video is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this video is for general information purposes only.
All right, well, let's get started, everyone. My name is Amma. How are you? Hello. Good evening. Happy Saturday. I am your host for PBTV, and I am also the owner of Incredibites, which is an Atlanta-based all-natural baby food company. So we are definitely excited. 1 a.m. in Ghana. Whew, I forgot the time difference. Oh, we are so appreciative of you logging on. But yeah, we are super excited to get started today. I would love to introduce you guys to Chanie, who is a labor and delivery nurse. And if you look at the pinned message on here, I also have her Instagram. So we're going to be covering quite a bit today. I am going to go ahead and invite her to join us and get started. We're good? All right. Hi, Chanie. Yeah. How are you?
Good. How are you?
I'm doing well. 3 months, 8 years. Wow. We have some. We have people putting in the ages of their kids, and we have some. Yeah.
I see someone here said she's 13 weeks pregnant. Pregnancy is the perfect time to start thinking about birth control. Because you don't want to start thinking about it after you have the baby, because you want to start already, knowing what your options are. So that's great.
Very, very true. Thank you so much for joining us, Chanie. So the floor is yours.
All right. Okay. So, I like to say this to my patients when I'm a labor and delivery nurse, and I also am a postpartum nurse and, newborn nurse. And a big part of my job in the postpartum side is education. And we do discharge education before any moms here who have had babies will remember this probably. Before you go home, we do full discharge education about everything important to know when you go home after having baby. And when I talk to my patients about birth control, I like to tell them, either you're trying to conceive or you're preventing pregnancy. There's nothing in between. Some people will come in and they'll be like, yeah, this baby was a surprise. And, it makes you wonder, like, what does that mean? Were you on birth control? And then it comes out, oh, they weren't on birth control, but like they were just having it occasionally. They're like, we're having sex occasionally. You can get pregnant with one act of intercourse. And women who have had a baby and are not breastfeeding can ovulate as soon as 25 days after they had their baby. That means they can get pregnant as soon as 25 days after they had their baby. And women who are breastfeeding can ovulate as soon as 6 weeks after they have their first baby, or any baby. Not only that, but we ovulate before we get our period. So the first time that a woman is going to ovulate after she has her baby is going to be before her first period. So she may not even know that she's ovulated. Some people think, oh, okay, I'll stop bleeding. And then when I get my period, okay, that means that I'm fertile again. So then I should start going on birth control. No. You ovulate for the first time before you get your first period. And breastfeeding, while it may help prevent pregnancy, if you want to use that as your exclusive method of birth control, then you need to be breastfeeding completely, not giving your baby any formula, no pacifier either. That means every time baby wants to suck, you need to be breastfeeding your baby, and baby cannot be eating any solids. So it's only good for less than 6 months, and it's very time consuming because you literally have to be breastfeeding the entire time. And even with that, there is a failure rate. So otherwise, like if you're going to give your baby a pacifier and you're not going to be breastfeeding your baby at least every 2 hours, you really need to have a different method of birth control. So if you have any questions, just interrupt me, let me know, because I have a lot to say on this. I love talking about this. Okay, so the first thing I'm going to talk about is there is a method of birth control called LARC, L-A-R-C, which stands for long-acting reversible contraception, which means that it is something that is long-acting, so you don't have to worry about it after you get it first placed. It is reversible, so it's not like getting your tubes tied or dad getting, snip, snip, vasectomy. But it is there, and you don't have to worry about it, and you don't have to do anything else. And the two forms of long-acting reversible contraception is an IUD or a little implant. It's about the size of a matchstick, and it goes under the arm right over here. And those are placed, they can actually be placed as soon as a woman's placenta is delivered. And people don't always know that. They have the option of getting an IUD in their uterus right after their placenta's out. And during a C-section as well. They put that IUD right into their uterus.
Now, does that affect, I'm sorry for interrupting, but does that affect breastfeeding?
No, it does not. It is safe for breastfeeding. All three forms are safe for breastfeeding.
Wow.
Yeah, they are actually an excellent, excellent option. And it wasn't always an option to get it in right after your placenta came out. And some women actually get it in before they go home from discharge. So maybe not right when the placenta is out, but before they leave the hospital. But it is completely not contraindicated with breastfeeding. Because there is a hormonal IUD, and the implant is hormonal, but it's the hormone progestin, which doesn't affect milk supply. Because there are two kinds of hormones that can be used for birth control, either the progestin by itself or estrogen and progestin together. So the estrogen might be a little bit problematic for some. Again, not majorly, but for some it might be a little problematic. That's why methods with just progestin are more preferred. And the copper IUD has no hormones in it at all. So that's completely not contraindicated for breastfeeding because it's got no hormones that it's releasing. And I'll go over each way, I'm gonna address each one, but it is an excellent option. You can get it also, obviously, after you've had your baby, when you go for your postpartum visit to your provider. Oftentimes they'll actually schedule a separate visit for that, and you can get it placed then. The benefits of waiting is that the expulsion rate, which means the rate at which there is a chance that it may become expelled from your cervix, may come out, is a little higher when you get it right after the placenta, comes out, because your cervix is still a little bit bigger. Your uterus has not moved back into the position that it's in before you got pregnant. So there is a smaller chance. However, the satisfaction rates that they've received, like reports from women, has been absolutely amazing, because it's just like, all done. Like you just do it and you're all done and you're all good. And of course, it's not a substitute to do a follow-up postpartum visit. But sometimes, unfortunately, women don't go to their postpartum follow-up visit, after they have their baby. So for someone that's at risk of that, like for someone who's got a lot going on in her life or whatever it is, she's just like, her home environment may be super stressful or whatever it is, and she's at chance of not going back, then that's an excellent option for her as well.
Question, because I did see a question just now, and the question was, why are we talking about birth control? So can you just take a second to explain, because birth control can be a controversial topic, but why is it so important for women?
So birth control, pregnancy is a very stressful thing on a woman's body. It requires nutrients, and if we don't have the optimal nutrition, the baby will take the nutrition from us. Yep. And close interval pregnancies, which are defined as getting pregnant less than 6 months after you had your other baby, there's been shown to be some more complications in them, like lower birth weight babies. And really the healthiest time to get pregnant is somewhere between 18 months to 5 years after you've had your baby. Of course, everyone's different, and some people will get pregnant back to back and everything will be fine. That's not to say. But just, the American College of Obstetrics and Gynecology, their recommendation is somewhere between 18 months to 5 years. So, if you are having sex at all if you, obviously some women don't want to have a baby at all, they have no children, and at this moment their relationship is not at the stage where they've decided to have a baby. Of course we need to talk about birth control, but for women in their childbearing years, pregnancy is very stressful on the body in so many different ways, and it can just leave you feeling really depleted. And you know, I'm Orthodox Jewish, and there is a misconception that Orthodox Jewish women don't use birth control. That's not true.
Very true.
Right. And even for Catholic women, there are natural ways, natural family planning ways that they learn, and that one can learn if they're, you know, opposed to hormonal birth control or any other barrier forms or an IUD, where they can also prevent pregnancy that way. So it's just important for us as women to ensure our health more than anything else. And if you have a baby or two babies or whatever it is, and you feel like you cannot get pregnant because it would just be too much for you emotionally, physically, mentally, then you need to take care of yourself for your other children. Your children need you. And if you look at any of the birth control, like the contraception birth control pills, let's say you'll buy, and it will come with a little pamphlet that'll tell you different things, risks, contraindications, etc., how to use it. It compares how many people die of complications from using the birth control versus how many people die of pregnancy. You know, and it's you're at higher risk of dying if you get pregnant. You know, because pregnancy, not that someone is at great risk for dying, but it should just translate to us that birth control is there for us to keep our health and for us to consider our family's health, our partner's health, and our children's health.
And I think that's a great segue. I see one question, like, what if the birth control doesn't agree with you? Then, like, what are some options there? I just saw that question. And then another one was, because you did talk about the Jewish and the Catholic faith. Yes, I'm about to be doing that when I get off this call. Yes, for the wine. So, right, exactly. It's Saturday night. Right. So, one, what should you do? Because I had that issue with birth control. It was breaking my skin out, so I just decided to take myself off. But if it's not agreeing with you, what should you do? And then what are some other options for contraceptive, I guess, besides condoms, if you don't want to use birth control?
Okay, so this is a great question, and there are so many methods. So even if one hormonal method disagrees with you, others can agree with you. Actually, like you said, your skin broke out. And I'm going to go into the birth control that would actually might be good for your skin, believe it or not.
Oh, yes, I need to hear that.
Yeah, so I'm going to quickly just go into the, because I started with the LARC, I just want to quickly cover that birth control. But when a woman is choosing birth control, you need to take a few things into consideration. Postpartum might be different than before you were pregnant. First of all, you want to consider the timing. Are you going to take the birth control right after you, leave the hospital or get the birth control, or are you going to wait a few weeks? Now, of course, breastfeeding, you want to consider birth control that's safe for breastfeeding. And then most are good, but there are some that may cause a dip in your milk supply. And then effectiveness, certain methods that women have used before they got pregnant, are actually may not be as good after, like the sponge, which is basically a sponge that has spermicide that kills sperm that you put in your vagina. That is not as effective after having a baby, actually.
What about the patch?
So the patch I'm going to get into, that's different. You're talking about the patch that goes into the arm. Yeah. So just those are the three things. So with the IUD, like I said, there's a hormonal IUD, there's a non-hormonal IUD. Hormonal ones are good for about 3 to 6 years. They release a really small amount of progestin into the uterus. So it's not like you're taking a pill and all the hormones are going through your entire body. So it's a much smaller amount of hormones than if you took a pill or the patch. So, and it goes right into the area that it's supposed to go in your uterus. So some people are you still there?
Yes.
Oh, you're back.
Yeah,
okay.
I'm listening.
So you just got froze for a second. So some people who have had a bad experience with pills, because there's a greater concentration in your body, they'll actually react really well to an IUD with a tiny drop of hormones in their uterus because it's so little. It's so much less hormones. That's why people like it. And the copper IUD, like I said, it releases a small amount of copper into the uterus. And what that does is it makes the uterus inflamed. And that lining on the uterus is no good for a baby to implant on it. So an embryo will not be able to implant. And that's what a copper IUD does. Now, the downside to that, it's good for 10 years, which is great too. It's good for 10 years. The downside to that is more women will often experience stronger periods and maybe even more painful periods and maybe longer periods. So if someone already has if someone already has painful periods or a lot of bleeding, that's not the birth control method for them. However, the IUD that has hormones in it, one of the most famous ones is called Mirena, that actually can decrease your period bleeding or completely take away your periods altogether. And it's actually been FDA approved, not just for preventing pregnancy, but for women who need relief from super heavy cramping and super heavy periods. So, and if this says anything, it has been rated the #1 birth control choice by female obstetricians. Okay, so women who are obstetricians are using that. But, so again, the benefits is that once it's inserted, you don't have to think about it. You don't have to be remembering to take any pills. You don't have to be remembering to put anything up your vagina, nothing. You don't have to be remembering to do anything. So again, 5% of people in the first year, it may come out. And then if you get it actually when you're right after your placenta, 10 to 27% chance that it might come out. So, but the side effects are lower with hormonal IUDs than with hormonal pills. So you might get a little bit of a headache, nausea, depression, breast tenderness. So, but the rates of effectiveness are really, really, really great for IUDs. There's a 0.8% chance of a pregnancy in the first year. And for hormonal, it's 0.2% in the first year. Okay, that means it has a 99.2% for the copper and 99.8% for the hormonal IUD. That's how effective it is, which is a super effective, and it's reversible though, okay? Yeah, and if this says anything, 74% of women who had the IUD placed immediately postpartum still had it 1 year later. So, in a year, 74% of women who got it still kept it in. But it can be removed at any time, and it does not affect your fertility. So as soon as it's removed, you can get pregnant right away. And it's about the size of a quarter. It's got like a little, two little, it looks like the teat's about the size of a quarter. It goes in, you might have some cramping for the first 2 to 3 days and a little bit of spotting. And that's it. And then taking it out is just you cough and they pull it right out. Now, if someone still doesn't like that feeling of an IUD in them, or they don't want to deal with hormones, or they don't want to deal with heavy periods, there's something called an implant, which is also, it is hormonal though, but it has the same amount of hormone as the IUD. It does have more hormone. It's circulating because it's over here. But again, you get the little implant in your skin right here, and that's it. You forget about it. Okay, so it is a little rod, and it's good for up to 3 years, so a little bit less than the IUDs. And again, it doesn't interfere with your sexual life. You don't have to do anything after it's inserted, and almost everyone can use it. It's contraindicated for very few people. The downsides are that there's unpredictable bleeding. Okay, so, and you can have some mood changes. You can have headache, you can get acne, you can get depression. However, it is 99.9% effective in the first year. That means only 0.1% of women will get pregnant on it in the first year. So it's got a really great effective rate as well. Now, and people can take, the only thing is if you want to get an IUD right after you deliver, that's something you have to discuss with your doctor or midwife beforehand when you're pregnant. And that's why I said this is perfect that some women here are pregnant right now and thinking about birth control options, because this is something that has to be planned ahead of time. You can't show up to the hospital and say, hey, I'd like an IUD, please. That doesn't happen. It's got to be, because some medications you can get when you're in the hospital. Right. That's got to be planned before, through your insurance company, whatever it is. It's got to be picked up. It's a little bit, And again, the downsides to getting an IUD or an implant is that you actually have to go to the doctor to have it inserted. Like you can't just buy it over the counter.
Now, is it something your insurance will cover, or is
Most of the time,
it
yes.
out of pocket? Okay.
No, most of the time, yes. Of course, sometimes there are, out-of-pocket costs because that's the insurance plan. But actually, it is a preferred method as well because it is cost-effective. It does cost a lot of money up front, but insurances will prefer it because they're not paying every single month for your birth control pills or for your, patch or for your ring. So if you, look at the cost over 5 years, it will be much cheaper than it would be to have birth control, to have pills. And again, you can take it at any time. 3 months later, you decide you want to get pregnant again, whatever it is, you just take it right out. There's no time frame where you have to keep it in for a certain amount of time. So that's the IUD. Now, let's talk about injections. There's also an injection option. Have you heard of that?
Yes.
So it's called the Depo-Provera shot, and basically it's also hormone that's injected. Same hormone, same progestin hormone that's in the IUD, same progestin hormone that's in that implant. However, it's a shot, and it's good every 3 months. I actually give it to some patients before they leave the hospital. That's not something that you have to really discuss beforehand. You can actually ask for it when you're in the hospital postpartum. You get that shot and you know that you're all set for 3 months. So even if you're not decided 100% at the moment, you can just say, give me the shot. I got 3 months to think about it. Let's see how hard this baby is. Let's see if this baby sleeps through the night or not. And then I'll decide, Yeah.
That's awesome. Okay.
Yeah. Someone said downsides of the IUD. So like I said, I told you about the side effects. It's an inconvenience that you have to go get it placed. There is a very small risk of it getting misplaced inside of the uterus. And again, it is a rare risk. I think that some people, they just hear about that piece. The people are like, oh my gosh, the IUDs, don't get it. My aunt's cousin, so they found it in her stomach and her entire stomach blew up, whatever it is. You're only going to hear those horror stories. You're not going to hear the 1,000 other women who are using it, who are so happy. They're not going to tell you all of their, they're not going to tell you horror stories. You hear the drama. You're going to hear the horror stories. You're not going to hear all of the benefits of it. But again, it's a personal choice, and if someone doesn't feel comfortable with it, there's so many other options. It's just a very convenient choice with not having to remember anything, and for someone with heavy periods, it may decrease the bleeding. So, it's just good to know. But those are the downsides. We discussed most of them, and then, like I said, there is a small chance of it coming. There's a little string, so every month or so, it's recommended to put your finger up your vagina just to feel that tiny little string coming out of your cervix. It's tiny and skinny, and it's literally up there. Your partner shouldn't feel it or anything if you're having sex. It won't be hanging out of your vagina or anything like that. You really got you put your finger up there, and it's there because we want to make sure that it's actually in. So just in case if something happens and you can't feel it, you go to your doctor or your midwife. They'll take an ultrasound to make sure that it's still in place.
Okay.
So that's what it is. So again, yeah, someone asked about the injection. So what the injection does is it prevents ovulation. It's good for 3 months. That means you're not going to ovulate. You're not going to drop an egg into your uterus for 3 months, and that means you cannot get pregnant. Again, you can get it right after delivery. The benefits are, again, it doesn't interfere with any sex. Almost everyone can use it. It is not contraindicated for breastfeeding. The side effects, there's a small chance that some bone loss may occur, kind of like, osteoporosis. But when you stop it, you'll regain, most, if not all, of that bone loss.
Well, then, during that, then should you take, I'll say fish oil or some type of vitamin to help restore the bone loss? Does that help at all?
I think as women, we need to always be conscious of that. Vitamin D and, getting our calcium and making sure that we're doing bone strengthening exercises, which are like weights and swimming and things like that. So I do think that it's for someone who's at risk of osteoporosis, it's probably not the best choice for them. It's good to know that. But again, it's like a reversible thing where you'll regain it. You can't use it if you have heart disease. Okay, someone who's got any heart disease or history of heart disease, they cannot use it. And the side effects could be irregular bleeding, headache, and a slight weight gain. Okay, so weight gain can be a side effect of the depot. So most birth control options that are hormonal are reversible right away. And I know that you asked me, you wanted to know fertility wise, does it affect your fertility? Most hormonal birth controls do not. So that means that as soon as you're off of it, the next month you can get pregnant right away. You know, meaning to say you have the ability to, they're out of your system. You know, they're not continuing to give hormones or anything. With the Depo-Provera shot, it may suppress your fertility for another few months. Like it may not necessarily be out of your system completely. So that's the only one where it may take a few more months. And, you know, I like to say it's got a 6% rate of pregnancy. So it's 94% effective. So again, the effectiveness is going down a little bit here. But again, if you don't want anything inside of you, but you don't want to have to keep remembering to take pills and you don't want to have to put anything in your vagina, it could be a great option for you. And it's 6%. Yeah, so I said that. Now, I had something else I wanted to add about that, but I just forgot right now. Oh, with fertility, when we were talking about fertility, you said that some of your followers wanted to know, does birth control affect your fertility? It may mask fertility problems that someone has, but it does not affect your fertility. Meaning to say, once it's out of your system, there's no long-term effect on your fertility. However, if you were on it and either you were never pregnant, so you didn't know if you can get pregnant or not, and now that you're off of it, you're trying and you suddenly see that you're not getting pregnant and it's been a year and you're not pregnant yet, it's not because of the birth control. It's because, you had that fertility problem beforehand, but you were on birth control, so you didn't know. Now, and then some people will say, oh, I was on birth control and my periods have gotten, more spread apart than they used to be. And I'm not ovulating as much. And they say, oh, it must have been the birth control. But the truth is that as we age, our menstrual cycles change as well. So you could have been a regular every 28 days, period kind of girl, and then something changes and maybe you're nearing menopause, maybe you're in your 40s, and then your periods are starting to spread out. It's not the birth control. It's just your body changing, but because it was keeping you on a regular cycle, as many birth controls do, we'll talk about the combined hormonal methods, then you don't know that because you're every 28 days, when you're taking those pills, they keep you on a 28-day cycle. So you're like, oh, and then suddenly went off the birth control and I couldn't get pregnant. I didn't get my period for 3 months. That's because now you're not having something artificial that's making the cycle every 28 days. So, and then we'll get right into that, the combination hormonal methods, which might be something you might want to consider if you want your skin to be nicer. Because what the combination hormonal methods do is that they're combined progesterone and estrogen. And they basically manipulate your brain into thinking that it's already ovulated, that it's already pregnant, and it's okay, brain, don't drop an egg for me right now. Don't ovulate, because it thinks, right? Because when we're pregnant, we stop ovulating, right? So it kind of tricks our brain into thinking we're already pregnant, and then it doesn't ovulate. And hormonal combination methods, so the progestin is what could maybe cause bad skin, but the estrogen actually causes nice skin. And so that can cause nice skin, and some people like it because it makes their skin nice. So you can take a pill. So combined hormonal methods can come either in a pill, it can come in a vaginal ring, and the most common one known is the Nuva ring, which is basically a ring. It's like the size of a rubber band that you would put in your hair, and you pop it right into your vagina. It stays there for 21 days. You can't feel it. Your partner can't feel it during sex. It just sits there, and then you pull it out just with your finger like that. For a week, you don't have anything in, and then again you put another one in. Okay, and again, it releases hormones into your body that way. So the nice thing about that is that you don't have to remember to take a pill every single day. So if you're traveling and you forget your birth control pack, somewhere, of pills, you won't have something like that. Or it's just hard when you're postpartum and your brain is in so many different places, and like just forgetting to take that pill, and then you start freaking out because that's when people get pregnant. That's when the surprises come, because they forgot to take their pill because they had so much going on. So the vaginal ring is nice with that, where you don't have to. And then there's the patch, okay, which is another form of combined hormonal birth control. So again, you keep that patch on for 21 days, then you take it off, and then you put a new one on. So, again, it stays there, and you don't need to remember it, but you do need to remember to take it off and to put on a new one, which is where some people might get messed over, because if they forget to take it out and it's in for too long, there's no more hormones in it. So it's not preventing pregnancy. Or if they wait too long to put another one in, then they miss that period and now their body can ovulate. So that's the inconveniences of combined hormonal methods.
I just, sorry to interrupt. I've seen this question 3 times, and so it's about the Paragard IUD. Is that similar to the nipple ring? That's the copper. Okay, got it. Okay, got it.
So that's the copper one that doesn't have hormones but can make your periods heavier. That's what it's best known for. But it's good also for 10 years, which is nice, because you got it in there for 10 years and don't have to remember. But again, it's nice with the combined hormonal birth control, where it doesn't interfere with sex. You don't have to do anything during sex. It can make your periods more regular, like we spoke about, and it can reduce cramps. It can improve your acne. I have that written down here, actually. And also any unwanted hair growth. So some people have excessive hair on their faces that they want to get rid of. And actually the estrogen, again, can prevent that.
That makes sense.
Okay, so some people will like it because of that. And, I like to say it's so personal what you choose to take. And I always say I'm not here to convince anyone of any method. There's really no one perfect method for everyone. Some people will say to me, what birth control should I take? I don't know. I'll give you all of the information and I'll tell you everything. And then it's for you to decide. If you just feel creepy with having something in your body, that's fine. That's normal. There are other options for you. So, but with the combined hormones, that's where the breastfeeding might be affected. The estrogen may affect the breast milk supply. It's a small chance. So it's recommended that women make sure that they're breastfeeding well for 4 to 6 weeks, that they have a good established milk supply, and then, bring in the contraception. So in the beginning, when you're establishing your milk supply, don't start then yet. Now, it can also increase the risk for blood clots in everyone. There is a small increased risk. But for a woman who are postpartum, they are already at an increased risk for blood clots, because just the state of pregnancy and postpartum makes you at an increased increased risk for blood clots. So now combine that with the hormonal combination hormonal pills or ring, so you're at an even greater risk for blood clots. So you should not start it until after 3 weeks after you had the baby.
So 2 things. So don't start until 3 weeks after you have the baby. And I know we're coming here to the end. So 1, I want you to please tell everyone where they can find you on Instagram, so they can message you questions directly. So that's my first ask.
Let me type this in. I can't believe we're coming to the end. I still had so much more to talk about. I guess we'll have to do part 2.
Yeah,
because I wanted to talk about the, let me then quickly just do the family planning, the natural family planning, because I know that woman asked, Academy. So, I did a hashtag instead of an,
no, it's fine. And I also included your Instagram in the pinned message. I don't know if everyone sees that as well, but at least they'll see it from me and from you, so they can go and follow you, because you have such great information.
Great, thank you. Yes, I love talking about this stuff. So just real quick. So the barrier methods are a condom, a spermicide, diaphragm, cervical cap. Those are all things that are fitted that go into your vagina. And basically what they do is they prevent the sperm from reaching the egg. So no hormones. So if you don't like hormones, no hormones here. they do have a lower effective rate. So it's about 12 to 21% of a chance of pregnancy in the first year. And it's a little bit annoying because it's not as spontaneous. You know, you have to put it on before, you have to put the diaphragm in. And if you forget even one time, you can get pregnant. The spermicide also can be a little bit irritating to some people or even cause an allergic reaction. So, you know, those are the downsides. The upsides is you don't need a prescription. You can just go buy it all over the counter. The diaphragm you do need to be fitted for, which is basically like a dome. But otherwise, you don't need a prescription for spermicide, for a condom, for the sponge, which is basically like spermicide. So you can just go buy that over the counter. They, you know, again, the only thing that prevents STDs is the condom. A diaphragm will not prevent it. And actually, spermicide may increase the risk of contracting an STD. So that is the downside of the spermicide, like, which is like jelly or like a little suppository that you stick up there. But again, it's nice not to have any hormones in your body. So that's the nice part of it. And then, you know, the fertility awareness method is often what Catholic women use, where they really learn how to see their fertile days and they don't have sex during those days. And it's typically somewhere between 5 to 7 days. So sperm can live up to 3 days in our bodies. So that means that if you have sex up to 3 days before you ovulate, before you drop the egg from your body, those sperm are still hanging out there and waiting to fertilize that egg. So people don't have sex 3 days before they ovulate. And then once their egg is dropped, it lives for a day. So no having sex that day either. Okay. So what you do is you take your, there's different methods, but there's taking your temperature every single day. And there's a tiny increase in temperature before you're about to ovulate. There's also people look at their cervical mucus and it looks like an egg white. It looks different when they're about to ovulate. And then also, you know, people plot their days. So if you have a regular 28-day cycle, you know that you know what your fertile days are because you'll know that you ovulate. You ovulate 14 days before you get your period. So there's no time that we can predict after your last period, but 14 days before your next period, which is hard because now if you have very irregular cycles, you don't know when you're going to ovulate. But if you consistently have cycles between 28 and 30 days, for example, then you just do 28 minus 14 or 30 minus 14. And you don't have sex during, you know, the 3 days before and the 1 day after. Either you don't have sex or, of course, you know, withdraw or you use a barrier method during that time. So you use a condom, use a diaphragm, use spermicide, whatever it is. It is time consuming. And you really have to learn things well. So the rate of effectiveness, again, it's 12 to 24% of people using it get pregnant in a year. So, but for women who are religiously opposed to birth control, it's just kind of a natural way of preventing pregnancy. So, you know, that's a good plan for people who again are opposed religiously. And you know, we as women, we have to protect ourselves and our health and keep our health, you know. So
yep.
In a nutshell, I have so much more, but I know that we and of course there's withdrawal. There's always the withdrawal method. If your partner cooperates, you know, you got to be really on top of that.
So that actually works? That actually works?
It is a 22% chance that you will get pregnant during, you know, in a year. About 22% of people who use the withdrawal method do get pregnant. So it is a high rate. And you got to be really careful every single time not to even get a tiny drop of sperm, of semen into the vagina. And they did a study in 1 year, 46% of people didn't converted to other methods of birth control because it was just so annoying for them. So 46% of people just found it annoying. Then there is also, I didn't talk about this, there's sterilization, which has a 100% method, which is, well, almost a 100% chance of not getting pregnant. So, you know, it's tying your tubes where they basically take the fallopian tubes that carry the egg to the uterus and they tie them off. Or a man can get a vasectomy, but it's permanent. Yeah. If somebody changes their mind, they can get assistive reproduction. help so they can go to like, a doctor that will do IVF or something like that. Possibly, it's not always. And it's really a permanent decision. So it's a big decision to make. Like if someone's 25 years old and on her second child, it's probably not the greatest thing for her. And when you're pregnant, you probably want to never have another baby again if you're not having an easy pregnant, if you're like me, But, I would say someone in their 20s who just has like one or two kids, it's kind of, someone said to me, they're like, yeah, even if I'm like in my 30s and I have 3 kids, like what if my husband crashes in a car accident tomorrow and I'm going to remarry and I'm going to want to have kids with my next husband, That was her reasoning, but it gives you pause for thought, like maybe don't make such permanent decisions
Right.
so early on in your life. So, but it is definitely that works 100%.
What if my husband gets in a car crash?
There is a tiny percent that it won't work. Sometimes, like they'll tell you for the first 3 months, use backup. I actually know someone who's an ultrasound technician, and she told me her craziest story was that the man got a vasectomy, and they didn't listen to the use backup for 3 months instruction part, and she got pregnant with triplets. So, that was a funny story for us, not for them. But
Right.
there's a tiny chance in the first year of still getting pregnant, but almost nothing. So
Now, before we end, I did see a question about women dealing with infertility issues. And so women who are dealing with infertility issues, any type of suggestions with birth control, no birth control, just have you dealt with that in your career?
So first of all, it depends on so many things. I have to tell you that there are women who had infertility, got pregnant, and then went back home and said, I cannot get pregnant anyway, so I'm not using birth control. And 10 months later, they come back to our labor and delivery unit, having labor with their next baby because they didn't use birth control thinking, oh, I had such a hard time getting pregnant to begin with. So first of all, anyone who finally got pregnant and they had infertility issues, unless you're okay with having another baby, which it might be a blessing to some, and it doesn't matter that mean necessarily that they will. However, with infertility, it's so specific. If someone never was pregnant before, about 6 months to a year in, go see a fertility specialist. Get checked out. That's for sure. Sometimes it could be a really easy small fix that they can do. But otherwise, I don't. If they have certain conditions that will cause them to have fertility issues, like recurrent miscarriages, then they may be told, because of clotting disorders, don't use hormonal birth control or whatever it is. But it's super, super duper specific to someone's condition, why they have the infertility. So it's like such a long conversation. But if someone did have infertility, got pregnant, use birth control, because people do get pregnant naturally after something. Sometimes, not everyone, but sometimes something wakes up in their body, and then the body's like, oh, this is how I do it. Okay, I got it. I'll do it again.
No, you have been so amazing. I see the comments. I see so many people saying, thank you so much.
Oh,
really appreciate this live. This is amazing. Like the comments are just coming in. So we definitely have to do a part 2 because these are things people think about all the time. For example, I didn't think about birth control once I was pregnant and had my child, but then some weeks afterwards, I'm like, wait, I think I need that. And so you're overwhelmed with all of the research and it's just a lot. So the fact that we are having this conversation is amazing. And like you said, being pregnant is the time to start thinking about that. And you dispelled a lot of misconceptions about birth control. So thank you so much for that.
My pleasure.
Thank you again. And as you guys see on the screen, go follow her. I went on her page. I went on your page, Chanie. And am I saying your name correctly? Is it Chanie?
You know what? It's Chanie because like I said, I'm Jewish, so it's
Hebrew.
It's okay.
Got it. Chanie. Did I say?
But my secular name is Alex. So my Hebrew name is Chanie, but my secular name is Alex. So you can call me Alex too. Okay. I answer to both.
Okay. Thank you for that. I'm so big on names. So, and am I saying, okay, so it's Chanie.
And you're Ama or Ama?
Ama.
Ama. I thought so. I love it.
Oh, thank you. I love your name as well. So yes, I went on your page. It is super informative, super insightful. So please, please go follow her. And we will definitely be circling back to do a part 2 because you are full of knowledge, okay?
I can't hear you. I don't know if it's me.
I hear you okay. Not sure, but you're full of knowledge. We got to do a part 2. So thank you so much for
Absolutely.
joining us.
Pleasure. Take care. Have a good evening. Have a good
All
week,
right,
everyone.
thank you, you as well. Everyone, thank you so much for joining us. This has been such an amazing spend of our time on this Saturday evening. Hopefully you guys are about to go do some more fun things. Join us for our next live on PBTV. I am Amma, your host, and it has been a pleasure being here with you guys today. Have a wonderful evening. Bye.
Thank you for watching. Make sure you like and subscribe to our channel, and of course, follow us on Instagram at PregnancyBeyond. Bye bye.